Hi, my name is Dr. Shanik. I'm a pediatrician in Lakewood, and unfortunately I want to speak a little bit about whooping cough. There's been a recent outbreak of whooping cough in Lakewood and the surrounding communities, New Jersey, the Northeast, Philadelphia. In our practice alone, we've had 2 new cases of whooping cough, both in the intensive care unit at Children's Hospital Philadelphia. One is in very critical condition. In addition, another child from the surrounding area, not in my practice, was just nifta at the end of last week from whooping cough, and they just had 6 new admissions at Children's Hospital Philadelphia as of this morning with whooping cough, and most of these children were either not properly immunized, not immunized. It's even possible to get whooping cough even if you are immunized. Unfortunately, no vaccine is 100% effective. It's really that with the full vaccine given, it really has a 95% protection rate, so there's still a 5% chance of catching the whooping cough even though children are properly immunized. Of course, the more you're exposed to these illnesses, whether it's measles, mumps, chickenpox, or whooping cough, the greater chance you have of catching it. So out of 100 children who are properly immunized, 5 may get it. The ones who are immunized, or ones who are not immunized, there's a greater than 50% chance of them getting it. It's really a very serious critical illness where children come down with a severe cough, a whooping type of cough, where they have trouble catching their breath, they become blue, cyanotic, they have trouble breathing, they usually end up in the ICU in a children's hospital, and it has a very high mortality rate, unfortunately. That's why years ago whooping cough was quite prevalent. Now with the vaccine, it has prevented these cases, but unfortunately there's a small contingency of people who don't necessarily believe in vaccines, who as perhaps are ruining it for the other people in the community. You can get protection from the whooping cough from actual vaccine and something called herd immunity, which is the type of protection you get from everyone else getting the vaccine, and therefore reduce the amount of bacteria in the community and less likely to get the whooping cough. Most children get the whooping cough many times from parents who actually get the whooping cough bacteria, but the whooping cough in infants and newborns is a very serious life-threatening illness, where older people, adults, when they get the whooping cough bacteria, they just have a bad upper respiratory infection lasting a week to 10 days with severe coughing, and they recover very well. But they in turn give it to the children and the grandchildren, and they're the ones who suffer. All children should really get 3 whooping coughs or DPT vaccines by a year of age, another one after age 1, and again usually before they go to primary, and then starting at age 11, everyone should get a Tdap, which is a tetanus and a whooping cough vaccine. Many adults have not gotten that, and in fact now, because of the chance of catching whooping cough, they're giving it to mothers after they have babies, and even pregnant women are getting the Tdap, the tetanus vaccine, whooping cough vaccine, in the 2nd and 3rd trimester. And by getting this vaccine, it prevents them from getting whooping cough, and it also gives protection to the newborn. The newborns get the vaccine starting at 6 weeks of age. It's just a terrible illness, and unfortunately we have to be very, very conscientious and encourage all our patients to get the whooping cough vaccine. Unfortunately, there's a small group who don't believe in this, and perhaps that's really making it bad for everyone else. I think in general, if your child's in a play group or in a class, and there are some children in the class who do not believe in vaccines, that's quite a disadvantage, and it puts you at a risk of catching the whooping cough and other illnesses. Again, the vaccine is only 95% protective, and after being exposed to whooping cough, and if you're being around people who can carry it, who don't believe in immunizations, it's putting everyone at a high risk. And therefore I think those types of people should not be allowed, and certainly if my child was in a play group, I would certainly not want to have that child in my child's play group, and I would really pull out.